COVID-19 has accelerated so much and so much innovation that normally could be years away.
Hi, everyone. I'm Barbara Humpton, CEO of Siemens USA, and thank you for listening to The Optimistic Outlook. As we confront this pandemic, all of us are having to weigh risks. And one piece of advice we keep hearing is that if we want to improve safety, go outside, which works well in the summertime. In this episode, I wanted to look at how we address the challenge in our built environment and how we can use technology and adapt our behavior to create safer indoor spaces. And that's why I wanted to talk to Scott Rechler and learn more about how his team has been using technology to reinvent office spaces. Scott is the CEO and chairman of RxR Realty in the New York metropolitan region. And believe it or not, his team is now 90% back to work in person at the office. Scott has served on the boards of both the Port Authority of New York and New Jersey, as well as the MTA, the Metropolitan Transportation Authority, and he currently serves as chair of the Regional Plan Association, which works to improve the economic health, environmental resiliency, and quality of life across the New York, New Jersey, Connecticut metropolitan areas. I hope you'll enjoy this conversation. Hey, Scott, welcome to the podcast.
Thanks, Barbara. It's great to be here. I appreciate you having me.
Well, when you look at your business's real estate portfolio, you view it not just as an asset for your company, you really see it as part of the regional community. Tell us how you got into the business that you're in, and how did you get to this view that your real mission is to help build communities?
Yeah, so I'm third generation. My grandfather actually started in the business in the late 50s, and it was always very focused on our customers and our community, and understanding how our community's needs were changing, how our customers' needs were changing, and that's what led him into his business originally, and building industrial buildings and suburban office buildings. And then as I got into the business, it became even more clear to me that as a platform, we have the ability and frankly, an obligation to make our communities better places for people to live and to work, and that our business is only going to be as good and healthy as our communities are. And so we made it as part of our foundation of our value set that doing good and doing well means doing better, and that we have as we judge our success, it's not just on our financial results, but it's also on what's the impact that we're having to our communities and making them stronger, and having long-term sustainability and vitality of our communities.
That's interesting. And of course, during this pandemic, you've had a moment where you've really been able to step up. I look at this and we're facing a health, an economic, and a societal crisis all at once. And I'm interested in how you're reinventing your business, how you're working with buildings to help people get to work post-COVID. But take us back to the beginning. How did you first respond, and how has this unfolded for you?
Interesting, a couple of things. One, New York really was the epicenter of this crisis, and an early area that was hit in New York is New Rochelle, where we're the master developer. So not only was it New York, but New Rochelle was the first place that was under COVID lockdown, and I remember engaging with the mayor as we're all trying to understand what was happening, and sort of the fog of war that was going on with him, and me asking, what can we do to be helpful? And there was nothing that came straight to mind. So, we activated ourselves, say, how do we help our community in this time of need? And so it was something that as you went through, you realized this was a moment in time that was going to be one where we needed to reinvent not only how we operate our business, but how we help our communities navigate through these challenges, and how we then ultimately position them to be stronger. And early on for us, we began to sort of get some insights as to what happened in COVID. I was actually in Hong Kong in the third week in January, and we have some of our largest investors are from Hong Kong, institutions of Hong Kong. And when I went, I knew COVID was out there, but I didn't really have a feel for what it was. And I landed, went to my meetings, and I had some conversations with some of these investors who were talking about some of their concerns. And frankly, literally, when I went back to the airport to leave, all of a sudden they were doing temperature checks. And so when I landed, I said to the team, I said, let's go meet with as many of our tenants that have global footprints, particularly in spots of Asia, to find out what they're seeing, how they're dealing with it, and what we might be expecting here. And then in early February, started a COVID-19 task force that literally has met every morning since then, where we've talked about the dynamics as to what's happening and where that may play out, and brought in public health advisors that specialize in pandemics to understand what that might be. And the same types of groups that were advising the governor, we were looking at the same charts to see where this might play itself out. And so it was, I would say by the beginning of March, I was actually out in Seattle and was meeting with Microsoft. And part of the meeting was talking about how do we think about the technology that we've been building to think about optimizing our buildings, and if there is a situation where we need to have to coexist with a virus. And as we're having that meeting, and I was with the head of real estate and head of the IoT group, I ended up getting we got a visit and told that we all have to leave the building. They were closing down the campus because of COVID until indefinitely. So you started to see it all come up. And so that was really where by that beginning of the second week of March, we knew we were going to be in something that was going to last longer. And then I think this wasn't going to be a blip. And so we immediately went into high gear of how do we reimagine our workplaces and our places where people live to be in a situation where they could be safe, they could feel safe, they get better transparency about the health and wellness of their building and the community around their building, and new tools that enable them to change their behavior so that while they're coming to work, they can get the most out of being in the workplace, even though it's going to be different than it was before. So we decided to invest as much as we could into that initiative with the view that this is going to be a long-term process. And so we've been going at it, for the last 120 days. And I think, I feel pretty confident to say I think we have some of the safest buildings in New York, and the feedback that we've gotten from our tenants is really, really, strong in terms of that they want to be able to look the employees in the face and say, you're coming back to a place that's safe, because everyone's got so much anxiety after being told that you need to lock down, and what is how contagious COVID is and the death rate is, and all these scary things that we've lived through over the last number of months, that it's hard to bring people back to work. And it's hard as a CEO to tell people it's time to come back to work. So you want to, be in a situation that when you do it, you're doing it in a way that they feel comfortable and empowered to be making this decision.
Yeah, I want to get into the technology of this a little bit, but first I want to ask you about terminology. I've been referring to this time as the now normal. I mean, everything's changing so fast. You use the phrase the new abnormal. Tell us what you mean. So,
what became clear is that we're going to have to coexist with COVID, and that is not normal, right? And so it's not going to be, hopefully it's not forever. But for some period of time, our life is going to be that we're going to have to learn how to change how we operate, how we engage as social beings, but coexisting with the virus. And so that's the new abnormal. And, I was originally of the mindset when I defined it as it's from, now until we ultimately have a vaccine. I think, as I've explored this more, I think this could be a, 2, 3, 4 year process, because the reality is you look at what's happening with the vaccines, and why I have high hopes that we'll have one, more broadly distributed sometime next year. Even if that is the case, the efficacy of the vaccine is expected to be maybe 50%. And there's, polls that say 30% of people are going to be even afraid to take it. So you have 50%, if they take it, may not be effective to provide them immunity. 30% may not even take it. So this virus is still going to be here, and we're going to have to figure out how to deal with it. And so it's going to be somewhere between the combination of the vaccines, effective therapeutics, and more, rapid diagnostic testing that will be able to make the new abnormal feel as normal as possible. And then over time, hopefully we'll be in a situation where it will be normal again. And it's a little bit analogous to 9/11, which we lived in the heart of that when that occurred, which was, there was a moment in time where the fear factor and your fear for and safety, frankly, people living in places like New York City and being in skyscrapers and being on planes there was a whole abnormal period where for the first time you were going through metal detectors and your trunks were checked and under your cars were checked and you had to go through turnstiles, all these new things that we all had to get accustomed to. Some of that shed away when we ended up building a bigger infrastructure, which took a couple of years of Homeland Security and Joint Terrorist Task Force, where we felt we created a level of safety. But a lot of that technology and protocols ended up staying. And I think that's going to be the same here in this, as we think about coming through this pandemic, is there'll be people's view and the importance of health and wellness and the fact that this may happen again are going to change how we operate and live going forward.
Yeah, so the idea of literally just making our built infrastructure safer, healthier for everyone is going to be with us for a long time. Let's talk about the role of technology then. You've been an innovator for quite some time, and you've been using technology in ways that others have not yet grasped, and yet you've reached even further during the pandemic. Tell us about the role of technology and the tools you're using right now to make your buildings healthier for all of us.
Right. And as you and I've had conversations in the past about finding ways that even we can collaborate with Siemens on this, we have a digital lab that we have set up that's been trying to think about how do we merge the physical and the digital to enhance the experience of our customers and optimize the use and efficiencies and productivity of our buildings. And we have 25 data scientists, product development people, programmers, engineers that are in-house, plus probably another 75 of outsourced support group that help us through these innovations. And so we were innovating more towards those types of use cases. And when COVID happened, we shifted the entire focus of the lab to helping us think through how we're going to prepare our buildings for COVID. And again, as I said, it's thinking about both the physical side and the digital side. And everything for us, which is part of the advantage, whereas being an operator, a fully integrated operator, is customer focused and spending the time talking to our customers, understanding what their concerns are, the challenges, and then trying to develop the use cases to help solve them. So for us here, it was really focused upon when people come to work, how do we use technology to make sure they are safe, right? So changing air quality, airflow, things of that nature, giving them the ability to feel safe, and tools I mentioned earlier for transparency and also behavioral change. And so it started, we created what we call RxWell, which starts with, every one of our tenants, when they come back to work, will download this app. And when they wake up in the morning, they'll, answer a questionnaire about their health and wellness, and have they been around anyone with COVID, or now in New York, have you been to any of the states that require quarantine for 14 days and have you quarantined? And if they get a green pass, they can come to the office. If they get a red pass, they can do one or two things. They stay home, or they can hit for a virtual care button, and they'll get a virtual care clinician who will then ask them a series of other questions, who can overturn the red to green if they wanted to. The other thing we have is on this is a wellness pulse, which is a package of information that if you were a tenant coming to work, of things that you might want to know. So, for example, what's the air quality? What's the humidity quality? Has there been a change in the level of COVID rates in the zip code where the building is, or hospitalizations or ICU? So it informs you that if you're concerned, you have pre-existing conditions, you're worried about something, you're empowered to make the decision about how much risk you want to take about coming to work or not coming to work. So that's something also that they can access. And then when they get to the building, we've changed our building. So now that all of our doors are touchless, so they open up automatically. As you walk in, there's thermal scanners that check your temperature. You'll show your green pass to a wellness concierge, which are now in all of our lobbies. We have wellness concierges, which is the physical part. If you have a temperature that's above 100.4, you'll be asked to come into this wellness lounge that we set up in the lobby, and we'll verify that with a handheld medical grade the thermometer as to whether it still is. And if someone says, well, I ran here, I had coffee, take some time, feel it out. And then if they still do, they can call again for virtual care, go home, go see a clinic, one of the clinicians that we have available to them. And even with the people that are our wellness concierges, was really trying to make sure that they were thoughtful, that the people coming in are going to be ultra sensitive, right? And so that we have to have a sense of compassion and how do you approach this? So we took them through Ritz-Carlton training programs. We had 200 people go through Ritz-Carlton training program to make sure that people feel that sense of hospitality and comfort coming back to the building. And then the same thing, touchless elevators as you go through, guide you to the elevator that you would be going right to your floor, limits the number of people in the elevator. Everyone needs to wear a face mask and social distance in the lobbies. We're actually using AI in our cameras so we can now actually tell if people aren't wearing face masks and aren't social distancing. And right now we're using it more for just measuring compliance ourselves. But in the future, you can use it to actually go to places where people aren't and offer them a face mask in that regard. And then in the buildings themselves, we have counters to ensure that we have what the level of capacity is in terms of the number of people in our space at any one time. So if it's in New York, it's a 50% cutoff. And so for RxR as an example, we're averaging about 42% of our space filled, even though we have now about 90% of our people back at work, because some are in our field offices, some are on vacations. And so we're every week monitoring that. We have tools that on your app, you can see from your desk if there's heat maps where there's congestion. So if you want to use the restroom or if you want to take the elevator, if there's a lot of people, you don't have to go until it opens up and walk to get there. A tool that at the end of the day will tell you if what percentage you social distance. So we'll give you a social distance score. So you'll be able to help yourself change your own behaviors in that matter. We're actually going to be implementing, again, face mask compliance in our public areas and our corridors. So we'll be able to, again, measure that and share people with compliance on that front. And then with new protocols even on cleaning, so that if your workplace is cleaned, you'll get a notification that your workplace was cleaned. So you have transparency that has been cleaned. Or if you were not feeling well or someone around you weren't, and you want a deep cleaning, you can just request on your app to get your space deep cleaned along the way. And then we have the last sort of pieces on the environmental testing, a new thing that we're doing a proof of concept with, which is we're having our cleaners wear PPE that is labeled, and when they're done cleaning each floor, goes into a specific bag that then goes for testing to see if we pick up any of the virus on either their shoes or their gloves. And if we do, since they're being tracked, we can see where they were, and then we'll go do surface testing. So the concept there is how do we stay ahead of where the virus might be going before it gets there? And since about 70% of the people who have the virus are asymptomatic or pre-symptomatic, this enables us to then say, okay, there's somewhere in here someone might have the virus. Let's go and ask them to do diagnostic testing. And so it's a really holistic program to, again, give people comfort, change behavior, but also preventative as well as we go through the process.
I love the way you're thinking about the whole person and the fact that it really does take trust before people are going to want to come back into buildings. And so thinking about the psychological aspects of service mentality associated with this, I think is brilliant. And I'm kind of curious about what the data is showing you so far. Are you finding, I understand your own workforce is back and engaged. At Siemens, what we've done is we've decided this is a time for a bit of a management transformation to get managers to understand that virtual can work too, and we ought to give people flexibility. What are you hearing about the effectiveness of the measures you've taken? And then are you seeing changes in the way people are using their built environment?
Yeah, so and I applaud you, by the way, what Siemens has done. I think it's it's smart to think about using this as an opportunity to empower people and judge them on performance versus showing up someplace or not. And I think that we've all learned new tools, right? And I think that that's something longer term as we return to the workplace more broadly. I think we're going to learn the best thing to do is just to take the learnings that we had from working remotely, as well as all the value of being in the workplace in terms of the engagement, the culture building, the mentorship, the sense of community that comes with the workplace, and getting the best of both. And as I speak to a lot of the large CEOs and heads of real estate that operate in the New York or market around the world, that seems to be where they're heading, is a more of a hybrid model where maybe there's a 5 to 10% group of their employees that actually work from home almost permanently and then come in for engagements. And then for the balance of their workforce, maybe there's a day or two or some flexibility to work remotely more regularly than they otherwise would. Now that they realize it can be done, technology works to be effective, and that people have learned new ways to manage in that environment. What I will say is, at this current moment, we haven't seen as many of the companies and workforce come back to our buildings or our peers' buildings as we would have hoped. We're probably at like a 15% occupancy level against 25 million square feet of space. And I think part of it is the anxiety that I mentioned earlier, right? That people have been nervous, lack of clarity as to where things were going. And I think we had some good momentum. And then when there was the social unrest and looting, that pulled it back a little bit in terms of where there was. I think the lack of clarity as to how this is all going to function. And I think public transit has been, unfortunately, an issue that a lot of the companies that we speak to say, okay, we totally feel comfortable in the building itself. You've done a great job. How do we get there? How do we get our employees there? How are they going to feel safe going to the buildings? And so, and I think again, that is a psychological issue, and that is one that that we have to all work on. I personally, my first day back at work, took the subway up to the office, posted my picture. Our teams are taking the subway and public transit. Now, in fairness, they're relatively empty right now. So this is the cleanest subways I've ever been on, and the most amount of room. But if you look around the world in places like Seoul and Hong Kong and Tokyo and other places in Europe that have really robust public transit systems that are now back to almost capacity, there haven't been any indications that the riding public transit has resulted in someone catching COVID. And so I think that the psychological barrier will be broken as more people start riding the subway and riding their other public transit and realize, okay, it's okay, we can do it. Now, I will say that this is fluid, right? So I'm also a big believer you got to keep looking at the data, keep looking at the science. And right now in New York, as an example, we're a sub 1% infectious rate on over 65,000 tests a day. So you feel pretty good. If that starts climbing to 3, 5, 10%, I think we're going to have to adjust, and we'll adjust ourselves along the way. And same thing, even as we go zip code by zip code, we're trying to see what that is. And as people come into our buildings, we're watching temperature rate adjustments or people calling in sick. So as much data that we can have to inform what our policies and recommendations are to our own employees and our tenants' employees is really, I think, what's going to drive this going forward. But public transit and public schools are probably the two biggest barriers that I hear relative to people being able to come back to work in a more normal setting. The one thing I'll just end this point with, because is that I think, to me, going back to your first question about commitment to community, I view this as a civic responsibility to get back to the workplace. For every one person that works in an office building, there's 5 service jobs created. And so, we're living through this horrifically challenging economic time. And if we're not going to all lead, and particularly the white collar workers that can afford to come back to work, but may by choice or because of anxiety not do it, it has the ramifications of the people that want to come back to work not having jobs because there's no people to serve. So like we've wanted to open up some of our restaurants and other things, for even just delivery services. We don't have enough demand where the people could justify opening up, even though they want to open up right now. And so my hope is, as long as things sort of stay stable, and now we're opening up schools in New York, and we'll see how that plays out, that we'll start getting a greater portion of the workforce, and maybe by the end of the year be back up to 50%, and then work our way after the new year to more.
Well, Scott, maybe an idea would be for us to think about one of the big problems that I think employees are going to have is childcare, especially to the extent schools are virtual. I wonder if there's anybody who would consider converting some of their space in office buildings to virtual learning centers for children, so that parents could come back to work and know that their kids have a good, safe place to proceed with their studies and their education.
Yeah, no, listen, I think to that just creative idea, and I can say this to everyone, this is the moment that everyone needs to be thinking innovatively, right? This is not a time to think about the playbooks of the past. We're rewriting playbooks for the future that no one's even had to think about before. And so any innovative ideas, whether that's driven by technology, by space, by new programs, we got to be thinking about them, because that's the only way we're going to be able to get live in a new abnormal that generates enough economic activity that we can bring unemployment to a level that's sustainable and deal with the poverty and challenges that people are facing right now throughout the whole U.S. And so I agree, we got to be as creative as possible.
Hey, well, I love talking to other optimists, and I'm telling you, this is fascinating and so inspiring to know that you and an entire team are just have a laser focus on this issue of buildings, absolutely central and absolutely needs to be solved while the weather's still good, because winter is coming, and
That's
we
right.
know that we're all going to be having to go back. We will all be going back inside, but let me set that aside for just a moment and pick your brain. I a little picture of the future. So we'll be with this for the next several years, and it is abnormal. But give us an optimistic view of what this world is going to be like, how we'll be using buildings, and how we can be productive and healthy in the world that you're helping to build.
So listen, I think, and I do have an optimist. I am an optimist. Probably the only thing more contagious than right now COVID-19 is optimism with me, right? So it's something that you have to think that way. But there's a reason to think that way. One thing that I will say that we've seen is this, going back to the innovation, is that COVID-19 has accelerated so much innovation that normally could be years away, whether that's in science, technology, almost every sector, urban planning, restaurants. New innovations have come up and have been brought forward that when we sort of get past this period of the new abnormal, or find a way to even deal with it more, we're going to see a period of enlightenment that I don't think we've seen in decades, because of this, what's currently happened. And hopefully the speed that it's happened because of collaboration and a reduction of regulation and bureaucracies that had stopped this before, that had no choice, like telemedicine as an example, right? That they broken down, and that they don't get rebuilt, because we should take the best of that. And I think we'll have that opportunity on the other side. And so generally, I think that's the case. I think we're seeing in places like New York that there's, this is a place that has been a magnet for talent historically. That's what has driven its growth, is that the best and brightest from around the world want to live and work in this marketplace and visit this market and this city. And I think that will ultimately get there. I think it's going to be a couple of challenging years, but what gives me a tremendous hope is that the big companies, the big knowledge companies that are, I think, the future of our economy, whether that's the Pfizers or the Disneys or the Google, the Facebooks or the JP Morgans, are all making enormous commitments to building new either headquarters or major hubs in New York City, with a view they're going to be growing here not for years but decades beyond. So that's going to be the magnet that's going to keep the jobs here while we cross the bridge to bring the quality of life back to what New York was before the pandemic. And then I think as we get to the other side, I think we'll have the opportunity to reimagine, reinvent ourselves better than when we left it. A New York that's more equal, an urban environment that thinks more regionally, so thinks about the suburban markets and the city, and creates an opportunity for them to leverage each other better to enable people to live a better quality of life, a more affordable quality of life, less pressure on our transit systems, congestion on our streets, more affordable housing, more of an emphasis on healthcare. I think we've learned that we have been underinvesting in our healthcare. And this is a prime example of it. So how do we reinvest in our healthcare, and how do we do it in a way that's more equitable and more accessible to more people? Now that we've learned how you can do that with technology along the way. And then even in things like we're doing in our buildings, interestingly, all the technology that we're putting in our buildings are things that have use cases post-COVID in terms of enabling people to understand what's happening within their spaces more effectively. Are there team members collaborating Do they have the right people in the office on the right days? Are they using the amenities they have? Is the space efficient? Is the air quality right? So all these things as we go into the next phase in our mind is going to create a healthier, more productive work environment and a better sense of community by providing those tools to people that make those decisions.
Well, Scott Rechler, that is a big vision, and I can't wait to work on it with you. Thank you so much for being with me today.
I appreciate it.
Please follow us on social media and on your favorite podcasting platform. Thank you for tuning in.